Madam Chair, we are now live on YouTube.
Okay, thank you. Good morning, everyone. This is the Public Employee Benefit Program meeting on July 31st, 2025 at 9 a.m. We're conducting this meeting here in Carson City, Nevada. I'd like to call the meeting to order. And since our last meeting, we have had 3 new members. They are Jim Wells, Kyoko Duncan, and Blaine Harper. And staff, will you please call the roll?
Good morning, everyone. Starting roll, Joy Grimmer.
Here.
Jim Barnes.
Here.
Janelle Woodward.
Here.
Laura Rich.
Here.
Jim Wells.
Here.
Blaine Harper.
Here.
Chris Vitton. I think I see him, but
Here. Sorry.
all right. And Keiko Duncan.
Here.
Thank you. Jennifer McClendon is absent today, but we do have a quorum. Please remember to state and spell your name for our transcriber. Thank you.
Okay, we will move on to agenda item number 2, public comment. Public comment will be taken during this agenda item. No action may be taken on any matter raised under this item unless the matter is included on a future agenda as an item on which action may be taken. Public comments will be taken under advisement but will not be answered during the meeting. Comments will be limited to 3 minutes per person. And I see we have someone here in Carson City, so we'll begin with you. Thank you.
Thank you. Good morning to all. My name for the record is Terry Laird. I'm the Executive Director at RPEN, Retired Public Employees of Nevada. Founded nearly 50 years ago, we are a nonprofit, nonpartisan organization with 17 chapters statewide and nearly 7,000 dues-paying members. We welcome PEB now under the umbrella of the all-new Nevada Health Authority, as well as any new members sitting on the board today, along with former board members, though we do have a few concerns as PEB moves forward with the Nevada Health Authority. RPEN's mission through the years of our service has been to protect the pensions and healthcare benefits earned by our members through their years of dedication while working. Many benefits that were promised to be there when they retired. Since the transition to the Medicare exchange many years ago, most of our members are comfortable with it, though it wasn't easy in the beginning when they were given a choice of going online to make their choices, something that many retirees still are not comfortable with. Since I became executive director of RPEN in 2016, we revamped our member newsletter to allow a forum for PEB through its executive officer to write a column at their discretion, whether it was during open enrollment or some other event that retirees should be made aware of. In the beginning, former executive officer Damon Haycock appreciated the opportunity and never missed a column, but unfortunately over time and with new executive officers arriving, the columns didn't seem as important. And then I took to printing the PEB board meeting notes as a former broadcast journalist myself. In the last year, via benefits, Chris Garcia has also taken advantage of this opportunity, and we are hopeful the new executive officer selected today will want to take advantage of this forum as well, especially in light of the changes ahead for PEB and the Health Authority. RPEN is also concerned with issues facing state employees. We do have quite a few active participants in RPEN who are still working. Regarding the Carson Tahoe Hospital issue with United Healthcare, earlier this year, the PEB board voted to extend that contract with Carson Tahoe until December 2025. However, we have since learned this decision was rescinded and the Carson Tahoe is telling clients they don't accept PEB insurance. We don't see the Carson Tahoe contract within item 11.4 under the status of contract negotiations either today. So we will be anxious to hear about anything during this meeting that may arise in regard to this troublesome issue. Thank you.
Kent Irvin, ERVIN, for the Nevada Faculty Alliance, the statewide association of professional employees at Nevada's public colleges and universities. First, let me give a warm welcome to the new board members, Dr. Keiko Duncan, Dr. Blaine Harper, Chris Vitton, and Jim Wells. We look forward to your service and maximizing state employee and retiree benefits within the fiscal constraints of funding revenue. We'd also like to thank Michelle Kelly, Betsy Strasberg, and Teresa Karsten for their past service on the board, as well as wish a happy second retirement to outgoing Executive Officer Celestina Glover. Thank you to Nick Proper for stepping in as interim EO. We also thank the two candidates for the executive officer position for applying, and we look forward to hearing your visions for PEB. With the transition to the new Nevada Health Authority per SB 494, there are many opportunities, but also challenges for PEB. This new board will have the task of discerning where services can be leveraged by collaboration within the health authority and when the unique nature of PEB requires its own direction for the benefit of employees and retirees. You have hard work to do and difficult decisions to make. The Nevada Faculty Alliance represents our constituents, professional employees at the Nevada system of higher education through advocacy, analysis, and our institutional memory of what has worked and has not worked in the past. We are available to support board members and answer questions. We are very concerned about two situations that need immediate attention from PEB. First, as mentioned, a permanent solution must be found for keeping Carson Tahoe Health in network for the many state employees in Carson City and the surroundings. What progress is being made? If CTH and UMR cannot cooperate, it may be time to go out for bids for different medical network and third-party administrator providers. Second, as of the June 30th budget report in item 6.2.1, cash reserves have fallen tens of millions of dollars below the actuarial mandated IBNR, catastrophic, and HRA reserves. What is the plan and timeline to replenish the reserves while maintaining plan benefits? Finally, we have reviewed the master plan document revisions in agenda item 8. They make sense and we support approval. Thank you very much.
Thank you. Okay, seeing no further public comment here in Carson City, can we go online?
Right a moment. One moment, Madam Chair. It looks like we have about 9 in the lobby. Let me get my slide up.
Thank you.
If you would like to call in to provide public comment, please dial 669-900-6833. And when prompted to provide your meeting ID, please enter 842-2647-1819 and then press pound. When prompted for a participant ID, please press pound. Joining the Zoom meeting as an attendee is for making public comment only. If you do not wish to make a public comment, please leave the Zoom meeting now so you're not accidentally called upon. Please feel free to watch it via the YouTube live stream on the PED YouTube channel. The link for the live stream is located on the agenda. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you'll be advised you have been unmuted. Please slowly state and spell your name for the record, then proceed with your comments. Amy Passon, please slowly state and spell your name for the record if you wish to make public comment.
Amy Payson, AMYPASON, and I'm representing the Nevada Faculty Alliance. I have submitted written comment, but I wanted to highlight some of the things in the written comment. First, PEB is headed into a new era under the Nevada Health Authority, and we are excited about the possibilities of being able to provide better health care for all our Nevadans under this new system. We wanted to also appreciate the work that was done during session on SB 494, especially talking with Stacy Weeks to be able to amend sections that related to PEB and certainly to the board membership here. We are grateful that we were able to clarify the independence of the PEB board through some of those amendments. As all of you that are sitting on the board, you represent state employees of different groups, and you know best about how the plan affects your employees that you represent and the different impacts and needs that we have for health in our state. And so we hope that you always keep in mind that as you are making decisions about our plans. We also appreciate the inclusion in SB 494 to be able to collect data and report on the healthcare costs for retirees. This was a study and some identical language that was part of AB 188 that was unfortunately vetoed by the governor at the end of session. But although AB 188, that was about restoring retiree health benefits to our state employees, even though that was vetoed, we hope that this board continues to keep retiree health benefits in mind as part of your overall decision making and continue to explore ways to restore retiree health benefits, especially for those who were hired after 2011. This is not just the right thing to do for our retirees that have already served the state, but this is also a mechanism to retain our current state employees who often have to think about whether or not to seek employment elsewhere, maybe to local governments or other states, to places that provide healthcare benefits in retirements. And finally, whoever is chosen as the executive officer, we look forward to and we encourage that executive officer to continue to have open lines of communication with advocacy stakeholder groups such as NFA, and encourage the EO to meet with those stakeholder groups. We look forward to collaborating with the new board members and the new executive officer as we work to make sure that Nevadans are healthy. Thank you.
Thank you. Caller with the last four digits, 4108. Please press *6 to unmute, and please slowly state and spell your name for the record if you wish to make public comment. We'll circle back to caller. Chris Syverson, please slowly state and spell your name for the record if you wish to make public comment.
I do not wish to make public comment at this time.
Thank you. Douglas Unger, please slowly state and spell your name for the record if you wish to make public comment.
Doug Unger, Dougunger, immediate past president, UNLV chapter, Nevada Faculty Alliance, and a member of the UNLV Employee Benefits Advisory Committee. Thank you, Chair Grimmer and the PEB board for your service and consideration. Concerning agenda items number 4 and 5, the interviews of 2 candidates followed by the recommendation to the governor's office of one to be appointed as the new PEB executive officer, we thank the 2 candidates and look forward to positive development for PEB's transition into the new Nevada Health Authority under new administrative guidance. We are also grateful that the governor and legislature are acting this week, which is about as swiftly as possible, I believe, to complete the PEB board appointments according to the new process set out in NRS 287 before these crucial decisions are made. It feels as though we almost have a complete PEB board, and that's very comforting. Not on the agenda today, but much on our minds, is Governor Lombardo's veto of AB 188, which passed the 83rd legislature with bipartisan support, a bill intended to raise contributions to retiree HRAs of $1 per month per year of service capped at 20 years, and as well moderately raise the limit that a state retiree can save up in an HRA for future medical procedures or emergencies. Reasons detailed by the governor's message for his veto are allegedly insufficient appropriations to cover, quote, the program's health reimbursement reserve requirements, unquote. Also, that implementation allegedly, quote, increases the program's administrative workload, unquote. State employee stakeholder groups disagree with these assessments, as reported to the governor in fiscal notes attached to the bill. In the interest of fairness to state employee retirees, we most cordially request of the PEB board and/or the new Nevada Health Authority to incur a modest expense for an independent actuary to revisit the accounting and report accurately on potential reserve requirements and administrative workload. State employee retirees have not seen a raise to HRA contributions in almost a decade of ever-increasing costs. Such an actuarial report will encourage faith and confidence in PEB's transition to the new Nevada Health Authority's administration and the positive changes that are, hopefully, on the way. Thank you.
Thank you. Note taker Kathy, you have been unmuted. Please slowly state and spell your name for the record if you wish to make public comment. Ian Hartshorn, apologies. Please slowly state and spell your name for the record if you wish to make public comment.
Thank you. My name is Ian M. Hartshorn, Hartshorn. I'm a professor at the University of Nevada, Reno, and a PEB member, speaking only as a member and on my own behalf. I'm speaking today to encourage the board to work diligently and in member interest to resolve the issues with PEB coverage in the Carson-Tahoe health system. The imminent loss of coverage is affecting me personally. I see a specialist at CTH with expertise in a condition that is not easily replaced. The upcoming loss of coverage has forced me to reschedule a surgery and basically rush it to ensure I don't have to pay out of pocket. Despite this, I'm lucky. The condition isn't life-threatening. For some PEB members in Carson City dealing with other conditions, not being able to access CTH could cause a life-threatening illness or force them into disastrous financial arrangements. For thousands more, it's a costly inconvenience that means more time off work and more time away from their families. I know members of this board have been working on this issue. Thank you for your service. I also know we have new board members, asking you to please familiarize yourselves with this issue and work diligently on it. If contractual obligations prevent a reasonable settlement with Carson-Tahoe Health, those contracts need to be rewritten. In addition to your fiduciary obligations, you have a moral one to our members. Public employees in the state's capital being unable to access the largest health network in that city is dangerous and unworkable. I hope you can resolve these issues in a timely manner, and I thank you for your time.
Thank you. Jean McFarland, you have been unmuted. Please slowly state and spell your name for the record if you wish to make public comment. Laura D, please slowly state and spell your name for the record if you wish to make public comment. William Paul, you have been unmuted. Please slowly state and spell your name for the record if you wish to make public comment.
Hi, it's actually not William Paul. It's going to be Dr. Dana Trippi. That's DANATRI, P as in Paul, P as in Paul, I. Can you hear me okay?
Yes, we can. Apologies for that. That was the display name I was shown. So go ahead and proceed to the comments.
Thank you so much. Good morning, esteemed members of the Public Employees Benefits Program. I'm Dr. Dana Trippi. I'm an obesity specialist and also a clinician in your obesity care management program. Thank you for the opportunity to speak on behalf of the state employees living with obesity and cardiovascular risk. I urge you to expand coverage to include GLP-1 medications for non-diabetic employees with established cardiovascular risk following the model of Nevada Medicaid. Cardiovascular risk or cardiovascular disease is the leading cause of death in the U.S., inflicting severe morbidity and mortality on our communities. Obesity is a key driver in this crisis, fueling chronic conditions like stroke, heart attack, heart failure. GLP-1 medications offer a proven solution. A 2025 analysis by Aon, which is spelled AON, a top U.S. consulting firm, found that GLP-1 users with obesity and cardiovascular risk saw a 7% improvement in medical spend growth by the second year. This was excluding medication costs. This was driven by a remarkable 44% reduction in hospitalizations for major adverse cardiovascular events, which we call MACE, which includes stroke, heart attack, and heart failure, compared to a matched control group over 24 months. As a clinician, I see firsthand the clear correlation between obesity and other chronic debilitating diseases. For example, in coronary heart disease, that population, out of that population, 80% of those are going to be overweight or obese. So GLP-1 medications such as Wegovy are a critical tool to break that cycle, improving health and outcomes and reducing long-term costs. Nevada Medicaid already covers these medications for similar populations. Again, recognizing their clinical and economic value. State employees do deserve the same access. By aligning with Medicaid's approach, you can ensure equitable care and empower employees to manage their health effectively. The evidence is very clear. Investing in GLP-1 medications, it reduces hospitalizations, it lowers medical spend growth, and enhances quality of life. I do respectfully ask the board to prioritize this coverage expansion in your health plan. Together, I know we can reduce that burden of cardiovascular disease, support our workforce, and create a healthier, more sustainable future for Nevada. Thank you very much for your time and consideration.
Thank you. Chris Syverson, you have your hand up.
Thank you, Nick. Hi, this is Chris Severson, CEO of Nevada Business Group on Health, and thank you, board, for allowing me to comment. There have been many comments on the contract between United Healthcare and Carson Tahoe Hospital. I just wanted to remind the board that Nevada Business Group on Health does contract with Carson Tahoe Health, and that we would be able to write our contract into United Healthcare and be the contractor for Carson Tahoe Health. If more information is needed, I believe that Carson Tahoe has been in contact with the contracting members. Thank you.
Thank you. Caller with the last 4 digits, 9199. Please press *6 to unmute. And please slowly state and spell your name for the record.
Good morning, Chair and members of the board. My name is Tess Opferman, that is spelled O-P-F-E-R-M-A-N, and I am speaking on behalf of the AFSCME retirees. I apologize for not being able to be there in person this morning. First, I know that there are a number of new PEB board members in the room, so I just want to welcome you to the board. I look forward to working with you over the coming months and years to put some much needed changes in place. First, I wanted to say a big thank you for Stacy Weeks for working with us on SB 494. We got some changes into that bill that we very much appreciated. One of the things that was added to SB 494 was the ability for PEB to produce a report about the costs faced by Medicare retirees. We look forward to working with this board, with you all, on producing that report so that we have a really good sense of the costs faced by Medicare retirees in terms of their Medicare coverage, and also look at their HRA rates. Those rates have not been increased in many years. They are receiving $13 per month per year work. We feel strongly that that needs to be increased, but we also realize there may need to be some data to back that up, and feel strongly that the report produced by PEB will help give us a better understanding of those numbers and expenses faced by the Medicare retirees. We were disappointed that AB 180 was vetoed by the governor. That bill had a number of provisions in it that we felt would be very beneficial to our PEB retirees. But we understand that was vetoed, and so therefore we look forward to working with this board and with the new executive director to make sure that our Medicare retirees get fair coverage throughout their retirement. With that, I look forward to hearing the rest of the meeting. Thank you very much.
Thank you. We're going to try caller last 4 digits 4108 again. Please press *6 to unmute if you wish to make public comment. Madam Chair, that concludes public comment.
Thank you. Okay, we will close agenda item number 2 and go on to agenda item number 3. PEB board disclosures for applicable board meeting agenda items. Deputy Attorney General Radhika Kanal.
Good morning, Madam Chair. Good morning, everyone. My name is Radhika Kanal, Deputy Attorney General for the record. This agenda item is to allow me to make a disclosure regarding conflicts of interest on behalf of the board members who are eligible for Public Employee Benefits Program, PEB benefits. Pursuant to NRS 281A.420, on behalf of the board members who are eligible for PEB benefits, or whose families are eligible for PEP benefits, I offer this disclosure that they will be voting on those items that may affect the benefits available to them or their family members. The law does not require abstention from voting merely because the board member or their family member is eligible for PEP benefits. At this time, I invite any member of the board who has any additional disclosure to make it now. Thank you.
Okay, seeing no additional disclosures being brought forward, I'll close agenda item number 3 and we will move on to agenda item number 4. Applicant interviews for position of executive officer of PEB. Applicants to be interviewed, we are estimating it'll be approximately 1 hour. And do we have our first interviewee?
Madam Chair, we'll take a quick break. I'll get a
Okay.
slide up and we'll get them escorted over here in a moment.
Okay.
So everyone just hang on tight and be ready in a few minutes. Thank you.
First applicant, Teresa Karsten.
Good morning.
Good morning. I'll start with the first question. Could you please describe your qualifications as they relate to the provisions of NRS 287 regarding the minimum qualifications of the executive officer?
So I have a bachelor's degree from the University of Nevada, Reno in psychology. So that meets, I believe, the health sciences requirement. And then I believe it asks for 7 years of experience pertaining to contract management, business administration. In my previous role as chief of managed care and in my current role as deputy administrator, I have a combined experience of about 7 years and 6 months of contract management and oversight of managed care entities, which is just Medicaid's language for health insurance programs for the low income population of Nevada. And oversight of actuarial services as well.
Thank you.
Mhm.
Okay, Jim Barnes asking, the position of PEB Executive Officer reports to the Nevada Health Authority Director and statutorily receives direction from the PEB Board, is accountable for the PEB budget, has obligations to plan participants, and is also responsible for the PEB staff. How would you create a positive working environment in the agency and develop a plan design that addresses stakeholder needs and wishes in a market with continued cost increases.
I think it's important for staff to feel supported and encouraged. I think for myself, I always encourage an honesty with my employees and coworkers. I think it's important for staff to feel safe to express free thinking ideas and not feel like they're going to be judged for that. So creating an environment in which they feel supported for their ideas and work. I think also celebrating big and small accomplishments helps staff feel supported. And then I think also creating an environment where mistakes are made are not the biggest thing in the world, right? So we always learn from success, but I think we can't fail to remember that sometimes our biggest lessons come from failure. The goal obviously not being that we want a bunch of failures, but to also recognize that as you're growing and learning, sometimes you don't always get it right. So I think that's important for a work environment. As far as working on plan designs with stakeholders, I think it's very important to work with the PEB board as well as getting more participation from the PEB members themselves. I know under the Nevada Health Authority, there are goals that include PEB. And so working with the department's community engagement leader to make sure that PEB's goals and objectives are aligned with the new health authorities, I think would be really helpful. One of the things that I would do in relationship to stakeholder engagement is kind of work with the team on identifying what's working, what isn't working, what's required, and do a gap analysis on that. I think where I work, some of the members have expressed to me that the gap is there's just not time in the day for them to participate and give feedback because they work during the day. And so looking at ways to engage members that maybe might be outside of work hours, workshops, listening sessions, things of that nature.
Thank you.
Good morning, Janelle Woodward. Describe your experience managing an organization that relies heavily on the use of vendors for providing statutory required services, including health insurance, if applicable, in your current or previous roles.
So while I've been at Medicaid, I've primarily worked with our managed care contracts. And they have several regulations and federal law, so I'm familiar with those. In addition to our managed care contracts, we have a contract with what's referred to as an external quality review organization, and they are responsible for assisting us in making sure that we are meeting compliance and performance metrics. And so I've overseen that contract for quite some time as well. And then lastly, we have multiple contracts or services with our actuary, one of them being the rate setting procedure that happens annually, as well as they work on our cost efficiency reports for our waiver programs.
Thank you.
Laura Rich, for the record, describe your experience with healthcare cost containment measures and vendor management with respect to healthcare containment.
So in my position at Medicaid, one of the various things that we do is look at utilization reports, cost trend reports, data on high cost utilization services like ED visits, high cost pharmaceuticals. And then we use that data to kind of drive our decisions around how can we contain costs or make decisions to lower costs in certain circumstances. So one example I can think of is we were asked why more of our mothers were not accessing long-acting reversible contraception after birth. And when we reached out to stakeholders in the hospitals, what we were told was, well, you don't pay for it. And we're like, we do pay for it. And the feedback that we got was, we pay the daily rate for the birth, but we're not paying for the supply and the insertion of the LARC. So when you think about that, that's numerous moms leaving the hospital without that contraception. And when moms have close band births, then that can lead to complications later. So we've changed our reimbursement structure. And I remember one of my staff saying, well, that's going to make us spend more money, not less money. And the idea of placing a LARC device that possibly can last about 5 years and preventing a very low birth weight baby from being in the NICU for multiple months. We explained to the staff how that's the cost analysis on the cost drivers that we were using. So I think just using that information to do data-driven decisions is helpful. And then we work with our actuary on several different risk mitigation strategies. Our MCOs are contracted to drive chronic disease management programs. So there's several other examples, but that's the one that came to mind.
Morning, Jim Wells. What is your leadership style with your staff, and give an example of how you have adjusted your leadership style when an objective was not being met or you were having difficulty persuading someone to your point of view?
So I think leadership style really has to meet the situation and the particular staff member or team that you're working with where you're at. My work right now is primarily with staff that have high level skills and abilities. And so I'm used to providing an assignment, delegating work and a timeline and expecting a result. But sometimes that doesn't happen and you have to adjust your style to address the concerns that you have. And so just recently, one of my teams was responsible for a project that I was notified by a different staff member was about 3 weeks behind target. And so what I did was I met with the staff, I brought them in, asked them some questions that would lead them to identify that they were missing steps in their process. And really what they came back and said was, we don't think we understood the assignment. And I said, you know, when you don't understand something, you need to ask for clarity. So we set some expectations about what they could expect from their supervisors and what we could expect from them. Coached them a little bit on, you know, utilizing your tools and your partners to get your project back on track. And so I think that really took the leadership style from the beginning of the project assignment, from like a delegative, like authority assignment, to more of a coaching and bureaucratic process, right? Like, here are the steps that you have to take to meet the policies and procedures to get us to the timeline for the project to be completed. Mm-hmm.
Lane Harper for the record. For the last 2 jobs you've held, take me through 1, when you left, why did you leave? And 2, when you joined the next one, why did you choose it?
That's a great question. In 2017, I was working as a health program manager for the Division of Public and Behavioral Health. And the staff in Medicaid contacted me to explain to me that their chief at the time was resigning to take a new position, and they asked if I would consider coming back. I really enjoyed my previous time with Medicaid and managed care, and in looking at the position, it was a promotional opportunity. So I applied and obtained that position. So that's why I left the Division of Public and Behavioral Health. And then the current position I'm in, I was asked in February of 23 to cover the position in an interim level and through legislative session. So working with the administrator at the time, because I was nervous to leave a position and become unclassified, because I think all classified people have that fear. So, and she said, please consider taking this on a permanent basis. You're doing so well, the staff are doing so well, and I really need somebody with a strong benefit coverage history that is good at directing this managed care benefit. And so I accepted that, and we've been cruising along ever since.
Good morning, Chris Fatone for the record. Describe first your goals for your first 6 months, 12 months, and 24 months if you're selected for the position.
So as a current member of the executive leadership team for the Nevada Health Authority, I recently participated in the leadership summit that was held. And what occurred at that meeting was the director of the department walked us through some goals for the health authority, and each of the team members went around on those goals and tried to develop specific strategies for each of their agencies: PEB, Silver State Health Exchange, Medicaid, just to name a few. And as part of that process, we were required to come up with short-term, mid-term, and long-term goals for specific strategies. And so I just bring that here because I don't have specific 6, 12, and 24-month goals for PEB, but what I would say is that I think PEB is going to be working closely with the department to make sure that their goals align with the department's vision. And I would be eager to be part of that process and make sure that that alignment occurred. I know for the first 90 days, if I was selected, I would focus on, understanding staff skills and abilities, roles and responsibilities, looking at the vendor contracts. Does that language, can it be improved upon to better serve Nevada and PEB members? Also, I think that's going to be a necessary step to meet the needs of the Nevada Health Authority, because one of the goals there is to align the state purchasing strategy. I'm very interested to see how that will be coordinated. But I think those would be my first couple of steps, working in coordination with the Nevada Health Authority to get the most that PEB can out of that new setup.
Morning.
Good morning.
Tell us about a time when you made a significant mistake in your work, how you corrected it, and what you learned from the experience.
And would you please identify yourself for the record?
Keiko Duncan.
Thank you.
Mistake, correction, learn, right? Okay. So the example that comes to mind is when I was working at the Division of Public and Behavioral Health, I had a grants project analyst on my team. However, their supervision and management was split, right? There was a program side and a fiscal side. And so the program side of that position was really led by me. And then the fiscal side of that component was overseen and supervised by Northern Nevada Adult Mental Health Services fiscal ASO. And I was told towards the end of close to budget closeout period that there was a significant overage in our budget, and that NAMS could not reconcile it, and they were having trouble reviewing the documents provided by the grant projects analyst, and were concerned that this overage was going to be a big deal at budget closeout. So I met with the grant project analyst. I collected the contract and budget logs, walked through those, found a couple more than a couple duplicative invoice entries, as well as an error in one of the calculations of the formulas of the worksheet, and was able to work with NAMS to show them where these errors were. And really it became from like a $60,000 overage down to like $1,500, which was much more manageable. So I would say, even though it wasn't my specific mistake, I think my mistake was in thinking that I could lead a program without knowing all of the pieces of it, especially the budget component. And so I worked with the fiscal team, the ASO over there, and said, you know, we need a new process. I can't have a program if I don't have a budget. So I will work with you, with the grants project analyst, review and oversee the logs that are turned in, and then work with you to check off and reconcile the obligations that then become expenditures, and then we'll make sure that the budget balances. And so I think what I learned is sometimes you're not assigned an activity, but it doesn't mean you shouldn't have eyes on the activity.
Joy Grimmer, for the record, tell us about a time where you were tasked with implementing significant program or policy change despite resistance from others. What specific actions did you take to accomplish the task and overcome the resistance?
So Nevada Medicaid was given legislative authority to expand managed care from the urban areas to the rural and frontier areas of Nevada after 27 years of us operating managed care. So there was a big lapse, right? So primarily managed care has always been in the urban areas. And so when the rural hospitals, critical access hospitals, and the county managers understood that we had been granted this legislative authority to move forward on this project, there was a lot of apprehension that we were hearing from them. So as a division, we decided it would be best if our administration and some of our managed care staff created what we called the Rural and Frontier Managed Care Tour. And so our goal was to go to each of the critical access hospitals, tour them, provide feedback and information, and a sit-down listening session of what your concerns are. Are there fears that we can immediately dissuade, or are there things that we need to work on and get back and fix and bring back, updates to you? And when the director of the Department of Health and Human Services heard that that was our plan, he said, this is a great time to send every division out there. So our tour grew, and each administration sent somebody from each division. So we had child welfare there, welfare and supportive services, aging and disability, and the feedback that we got from almost every one of the hospitals and counties that participated was, this is like a one-stop shop of answers that we've been looking for decades. And so really, once we were able to provide, responses and resolutions to their concerns, as well as give them information on what managed care is, it's not a big scary thing. And they do have requirements in this contract that are going to require them to invest in their communities. What are your community's health needs priorities? What can you ask of them as part of these community reinvestment dollars so that, this benefits your county and accessibility within your county? And that really helped. We got a lot of positive feedback from that. Everybody was left with names and telephone numbers and emails addresses of people that they've said they've been looking for 25 years. And so I think, nothing gets solved overnight, and you didn't build Rome in a day, but I think it really strengthened the access with our rural partners.
Jim Barnes, for the record, ethics are a key factor for leaders in public service. Tell us about a time when your ethics were challenged at work and how you dealt with it. What specifically will you do to ensure high ethical standards in the Public Employees Benefits Program and the protection of the public trust and fiscal stewardship?
So as far as ethics is outlined in the Nevada revised statute, I don't have an example of a challenge specific to those instances. I will say that throughout my career, you always feel challenged in your role with a scenario of whether you feel something is right or wrong. And I think that's just living life, right? Like everybody gets that. I think one of the experiences that comes to mind for me is when I came back to Medicaid, I had a vendor call me and say, you know, we were asked to do some work for Medicaid. The team doesn't report to your team, but it got put in our contract and we've been paid for it, but we never completed the work. I was like, well, that's odd. What happened there? Turns out that for this vendor to complete the work, what they needed was data from the division that the division was going to get from an outside source. And the team that was responsible for it kept communicating that the data wasn't available. So the vendor's concern was that it was towards the end of the year and they had to close out their books and they had money on their books for something that they didn't complete. So first of all, honest vendor, love that. That could have been really bad if they didn't self-disclose that. So what I did was I worked with our fiscal team to let them know that we did in fact pay money for projects that had not been completed. But I also knew that I had work that needed to be done that was federally required for something that ironically did not end up in the budget bill the previous biennium. And it was an independent review for a new plan that we had on board. So what we did was we talked about, you know, do we need from a fiscal perspective to have them return the $60,000 so then we can expend it on a different project? Or can we revise through an amendment process and documentation on fiscal's end and the vendor's end to amend and say that this $60,000 was more towards this project that they're going to start now, and then the remaining balance of it being applied at the next start of the fiscal year. And so in working with administration and the contract vendor through that, we were able to come to agreement to move the money. And then I said to administration, like, it's great that we didn't spend money, that we didn't get like that. It's taxpayer funding, like we can't spend money that we don't get something for. So I'm glad that we were able to identify it and move it. But the largest piece is, how did that happen? So we worked with all of the leaders of the people that were involved, and we created a process and a training for them so that they really understood, like, we can't pay taxpayer funding for services that are not received. And there are supposed to be processes in place for that accountability. And I think what happened is we just had a group of people at that time that were leading a project and not leading money. And sometimes we need to train our staff that projects are money, and we have to be in alignment on all of those requirements.
Thank you.
Okay, Janelle Woodward. For the record, currently PEB provides a consumer-driven health plan option and health maintenance organization in Southern Nevada and exclusive provider organization in Northern Nevada. How would you go about assessing these programs and their effectiveness currently with respect to coverage and fiscal sustainability? And how would you use these findings to improve options for PEB members?
So I think I talked a little bit in the beginning about reviewing the contract language and requirements. I know as a previous member of the PEB board, there's a lot of data online related to utilization reports and benefit coverage. And so I think, one, when you say assessing the effectiveness of the needs, I think really, who decides that, right? Like, members we have to have feedback from members on what's working for them and what's not working for them. And first we have to get them to the table. And I recognize, you know, my time on the board was short, but members really only showed up when things weren't working. And they were in dire straits. And I think, yes, we absolutely want to address those issues, but we want to address the needs of the members that, you know, don't understand their insurance, aren't accessing and utilizing their insurance for preventative care because they don't understand how their insurance works. So I think there's a lot of things that can be done in assessing the programs and the different types of coverage. I also realize and recognize, you know, this program is a little bit a lot different than the one that I currently operate as a self-insured funded program. You have to pay for the claims as they come in. And so making sure that the information that you are getting from your actuary and claims data information is going to be really important. And then I think also as we were participating in the leadership summit, PEB staff, you know, really did describe the differences in the different programs and how the concern, right, of if we're able to use one contract for mass purchasing power, how are we going to account for all of those differences? So I think it's going to be really important to work with the board, work with the members, and work with lawmakers to understand how all of these different things are going to impact the goals to get us to better coverage, more sustainable coverage for all Nevadans.
Thank you. Right, last but not least, Laura Rich, for the record, is there anything else that you'd like to share with the board about your application and interest in the position? And if you're appointed by the director of the Nevada Health Authority, when would you be available to start?
So let me ask you your questions and then I have questions for you guys. Okay. So I just want to say I would be very honored to be selected for this position, but I love our state employees and our retirees, and I think in the last 3 years of Medicaid, 3 of our staff have passed away. And I just think it's really important to make sure that we have quality coverage for our staff and that they understand how to utilize it so that they can live healthy and long lives. And then because of that, if I'm not the best candidate, no harm, no foul. I'm perfectly fine where I am, although I would love to learn new things and be of use. But I really do think it's important to pick the best candidate because we've got a lot of big changes coming through the health authority. So we're gonna have to have strong people lead through that. And then in relationship to starting time, I do have annual leave. I'm leaving the country from August 13th. I'll return the 25th to work. I've discussed with my Medicaid administrator, you know, if I was selected for this position, I don't know what would be a good time for her. And she has basically said that if I can be available for phone calls and support through the transition of replacing my position, then, you know, next week, you know, but so I know decisions aren't made that fast. So I think as far as time is concerned, as long as you don't expect me to show up while I'm out of the country, then I will be here. I do have kind of two questions, compound question. What would you like to see as a board continued changed or new ideas from a new executive officer, and what skills and abilities would be needed to implement what you're looking for?
Who would like to take that?
I think Laura Rich, for the record, being that I was previous to Celestina Glover, I was the executive officer, so I can appreciate the position. I think that the Nevada Health Authority provides a lot of potential opportunities. And I think that, you know, PEB has been in kind of a status quo type situation for many years now. And And I think these opportunities would be great. We don't know what those opportunities are, but having someone that can come in and be willing to disrupt things and to really challenge what is in place today and not just accept, well, this is the way the state does things, is very, I would appreciate that personally. I think it's necessary, in the agency. And, I see the utilization report, I see the budget report, right? It's things are just getting more expensive. Healthcare is more expensive. And I did appreciate what you had said. People don't understand their insurance. They really don't. And while the high deductible plan is probably the most efficient of our plans, I really do think people don't use it. It's efficient because people don't use it because it's expensive for them, right? It's for a good portion of them, right? You have to spend that deductible. And for our state employees who can't afford that because they're so, they're living paycheck to paycheck. And so when you've got to fork out $2,000 or $3,000, before your insurance even kicks in, a lot of people just don't go to the doctor, right? And then when they do, it's very, very complicated. I can tell you, I was the executive officer of PEB and was on the CDHP and broke my hand, and I was probably the person best positioned to navigate my healthcare. And I still had to go into the UMR office and ask, why are these claims being processed this way? Why is this being processed that way? And I had that luxury, but most people do not. And so I do appreciate your comments about, helping members and navigating insurance, because it's complicated and we don't make it easy. Not just PEB, but
Insurance in general.
insurance in general is just not easy.
Thank you.
Did you have any other questions?
Nope, that was it.
Thank you.
Thank you.
Or would you like me to put up the break slide real quick?
Yes, please.
All right, one moment.
Thank you for being here today. We're going to take turns asking questions. So I will start with the first one. And for the record, we have Holly Luna here as an applicant. Could you please describe your qualifications as they relate to the provisions of NRS 287 regarding the minimum qualifications of the executive officer?
Sure. So first, I believe, thank you for allowing me to come and join in this opportunity for the executive officer position. And I believe that my qualifications are that I've had almost 20 years of public service experience, and the first position that I had, good morning, Mr. Wells. I worked for as a CFO for the Douglas County School District, so I do know Mr. Wells from that. At my time at the school district, I managed the departments of budget and finance, as well as the self-insured health insurance programs and the workers' compensation programs. While I was there, I also managed the capital and bond financing programs. And additionally, in that capacity, I managed 7 departments, and so about 110 plus employees. And then since then, I have also worked at the Airport Authority in capacities of the Director of Contracts and Procurement. In that position, I managed multiple contract negotiations and the solicitation processes, sometimes very complex processes for construction. And in my current capacity as the Project Controls Director for the More RNO program, which is a $1 billion infrastructure program at the airport, I am managing executive summaries, dashboards, and financial summaries for key stakeholders. Thank you for that.
Jim Barnes, for the record, good morning.
Good morning.
The position of PEB Executive Officer reports to the Nevada Health Authority Director and statutorily receives direction from the PEB Board, is accountable for the PEB budget, has obligations to plan participants, and is also responsible for the PEB staff. How would you create a positive working environment in the agency and develop a plan design that addresses stakeholder needs and wishes in a market with continued cost increases?
That is a very in-depth question. And I think it's deserving of a great answer. So I hope I could provide that. I think the first is that I would want to work with the director and with the PEB board of understanding kind of the near and immediate goals of this transition from PEB as a standalone into an integrated position. And I would want to have, obviously the first is that we'd want continuity of leadership. So it's coming in, understanding the groundwork, understanding what the current priorities are, not wanting to shift those immediately, right? We need to have a continuity and uninterruption as you transition leadership, but would also want to look, as you'd indicated, the financial stewardship. It would be understanding what the shared contracts as we go forward with the whole Nevada Authority versus a standalone PEB, working to see what those solicitations, as you'll do as a combination, what that can provide, whether that's through the benefits program, the pharmaceutical, those contractual obligations will make a very large difference for PEB itself. Obviously, with the budget constraints, I'm going to have to get clear narrative from the director and the board, and perhaps have conversations with legislators as well as to what the intent was and how to move forward. So I want to prioritize, stabilizing the current plan environment while ensuring some operational resilience and being able to move forward. I don't want to come in and dismantle or disrupt the current staff. I want to build on what exists. And I understand that there's got to be great institutional knowledge amongst PEB, as well as with the folks that, director weeks with the Nevada Health Authority and the other programs that'll be pulled into there. So I want to foster a knowledge in the current team environment so that they have ownership and have autonomy and feel respected.
Thank you.
Good morning, Janelle Woodward for the record. Describe your experience managing an organization that relies heavily on the use of vendors for providing statutory required services, including health insurance if applicable in your current or previous roles.
Could you repeat it again? I just want to make sure I
Sure.
heard the question.
Sure. Describe your experience managing an organization that relies heavily on the use of vendors for providing statutorily required services, including health insurance if applicable in your current or previous roles.
Thank you. So in my previous role as the CFO for the Douglas County School District, as I indicated, managed both the self-insured health insurance program as well as the workers' compensation programs. And so both are required. And so with that, the self-insured health insurance program, we manage contracts through a broker for both the administration of the program because it was self-insured. And with the workers' compensation, we worked with insurance carriers. In both, we had the stop loss insurance that we needed to negotiate. And amongst all of that, it wasn't as if it was standalone me making these decisions. We had a self-funded health insurance committee that was utilized both union representatives as well as district representatives. Then, of course, we had a broker that provided dedicated plan suggestions and benefit programs. On the workers' compensation side, that was more directly with working with a broker of choice and utilizing actually other school district resources as well to understand what they were doing and how they were combating certain pricing complications. And so I think those would be what I managed in my prior position.
Okay, thank you.
Laura Ridge for the record. Describe your experience with healthcare cost containment measures and vendor management with respect to healthcare cost containment.
So I think that there's a number of things that you can look at. Obviously, one of them that is it's very complicated is the prescription and the prescription costs. And because it is not a transparent system, the way that it is currently set up. And so that one's very difficult to manage, but I also feel like that is where when we're talking rebates, that that is something that is where you could see additional, price decrease to the plan user. When it comes to the healthcare costs, the medical cost, one of those is one of the main drivers there is obviously plan benefits. And so you have to take a look at your plan document. And there are things that are required now with the Affordable Health Care Act, and there are things that are not required. And so you have to take a look through a lens where you are doing a plan benefit analysis and really digging into the detail of what that plan document is allowing you to offer, and applying that consistently, as well as looking at, your plan users and your members and understanding if you do make a change, how that impacts those members. But I would say that your plan document is a major driver of your healthcare costs, and as are prescription. And obviously, when you have very large single user medical costs, I understand that there's a lot of increased cancer users expenses right now. And so, that's just taking a look at your stop loss as well and ensuring that you can get the best stop loss contract.
Thank you.
Good morning, Jim Wells, for the record. What is your leadership style with your staff? And give an example of how you have adjusted your leadership style when an objective was not being met or you were having difficulty persuading someone to your point of view.
Okay, thank you for that question. My leadership style is to provide a backdrop where I am available and ready in the event that you need my assistance. I really prefer an autonomous workforce where the folks that are in these positions are there for a reason. They've been hired in due to their expertise and background and knowledge. And that my style of leadership is one where I would encourage you, where I would, again, be the backdrop if you have questions, concerns, that I would be a resource for you. I would be collaborative in working and resolving through problems, specific challenges. I think one of the things that is a useful tool as a leader is to ask questions versus just being primarily responsive to your question, allowing you to kind of work through that process and provide alternatives yourself. As far as a particular instance where I may have had to change that, if you have someone who might be reluctant to make that decision or to provide input, it could be by choice, it could be by lack of willingness, or it could be by lack of background or knowledge. So as an instance, I had an employee who was reluctant to do public presentations, even though that was part of the position. And it wasn't because she was not willing. It was merely a matter of this person being uncomfortable in doing so. And so it was a matter of kind of digging into that and understanding what was the reason for the lack of willingness to do that. And after providing job shadowing and opportunities in which she was not the front and center of the responsibility, and she was allowed to move into the responsibility over time. She's since been very successful and has been complimented by people on her public appearances and speaking engagements.
Blaine Harper for the record. For the last 2 jobs you've held, take me through 1, when you left, why did you leave? And 2, when you joined the next one, why did you choose it?
Great question. So I have not left my current position, so I won't have a conversation about that. But I joined as the Chief Financial Officer at Douglas County School District, had indicated that I needed to move into a different segment of my life. I had had a child and I wanted to move from the Bay Area. I had never worked in public sector and was very interested in it. And my background and extensive financial knowledge translated well into that position. And I served there for 11 years. I ended up resigning and I moved temporarily to Montana for some personal and family reasons. At the end of that same year, I was there almost 11 years. At the end of that same year, I took on the role of contracts and procurement at the airport authority. And I chose that position because it gave me an opportunity to work in contracts and solicitations. I think back in the day, I might have wanted to be an attorney. And so having that access to contracts is still a very fascinating role for me, to be able to dig into language and verbiage and to look out for the best interests of the entity that I work for. And getting the best bang for the buck, if you will, and problem-solving solutions. I really very much appreciate the contracts and solicitation side of the house. I will tell you that in my current position, I was appointed to the position of the controls, More RNO Project Controls Director by the President and CEO. and I was selected for that position because of my financial acumen and my ability to communicate well and thoroughly and be responsive. It's a $1 billion infrastructure program. It's going to happen over the next 4 to 5 years. It's a very small group of people doing a very huge lift, and I feel that my background and my leadership style, the president and CEO felt that that was a very good fit, and so I was appointed to that position, and I remain in that position to this day.
Good morning, Chris Fatone for the record. Could you describe your goals for us for your first 6 months, 12 months, and 24 months if you're selected for the position?
I was going to ask the question at the end of the meeting about what the PEB board and the director wanted for that. So in the meantime, what I'll do is I'll describe without that knowledge how I would approach that. In the first 6 months, my intent would be to glean information. It would be a lot of meetings and cooperative conversations with the various key stakeholders. That would include the PEB board, that would include Director Weeks, that would include legislatures who facilitated AB 494 and really digging into what are the opportunities and the immediate challenges that we need to address immediately in the first 6 months. It sounds to me from everything that I have read is you already are underway with some very large changes of your core NV implementation. I do have a background of ERP implementations as well. And so that would be of interest to me to make sure that that continues and that that is a successful implementation. It sounds like HR and payroll is, you're in the thick of it and it needs to be, facilitated. So I think the first 6 months is a lot of gathering of information, listening, and then in the following 6 months, which would take you through a year, would be looking to implement some of those changes. If there are quick wins, categorizing quick wins versus long-term goals, help facilitate those quick wins, whatever those might be. And then in the greater 24 months, that's where the real rubber is going to meet the road with regards to the combination and integration of PEB into the Nevada Health Authority and looking at those solicitations and contracts and seeing where we are going to be best served from the combination and the integration of PEB, whether that be having the shared contracts and reaping the benefits of lower administrative costs, having the shared benefit network so that we have greater access and lower costs to our members, better healthcare access, having potentially smarter budget and forecasting, where you can have enhanced actuarial forecasting and financial modeling for a sustainable plan funding. And then really just strategic data sharing and information amongst the various organizations that are going to be feeding into the one Nevada Health. I think that real work it's going to take time to build the momentum. So we need to separate what we can look at as short, very short-term, near-term wins and get those under your belt. I think that if you can show not only your team, our team, but the Greater Nevada Health Authority, their team, that you're able to successfully implement some small changes and move towards that integration, that helps build momentum and that people are more willing and more have a determination to meet those longer term goals that might be a little bit harder to integrate and proceed with.
Renee, take it on for the record. Tell us about a time when you made a significant mistake in your work, how you corrected it, and what you learned from the experience.
A significant mistake in my work. I can think of one as the CFO for the Douglas County School District. It was not, I think it was about 2 years in is when the Great Recession hit, and we really started to see significant forecasts of decrements to the K-12 funding from the state of Nevada. And as probably everyone is aware, it's very difficult to steer a governmental ship, right? And so a school district is very reliant on state funding. And one of the things that we needed to do was to have conversations about what to reduce and where and how to facilitate those reductions. And so one of the things that I would say was a significant mistake on the front end was I had asked for, various costs associated with different initiatives, if you will, within the school district. And I did not verify those costs, and I ran with those costs. That did have significant input later on as we were, challenged on certain things about the cost of X versus Y or the pros and cons. And I did have to go back and review each of those costs. I did that personally. And I think what that proved to me was to do some trust but verify moving forward.
Okay, Joy Grimmer for the record. Tell us about a time where you were tasked with implementing significant program or policy change despite resistance from others. What specific actions did you take to accomplish the task and overcome the resistance?
It's a great question. And it was, I actually volunteered at the airport authority in my past position as the director of contracts and procurement. I volunteered to project manage the ERP implementation, which is ERP is enterprise resource planning. It's the financial system. It actually also integrated the HR system. The way that the authority chose to implement the system was kind of an unfortunate set of circumstances. They implemented the HR first and then implemented the finance, which is a little difficult to go back into when you take a look at a system that's really built upon a core backbone and structure of a financial chart of accounts. So it really would make more sense to do chart of accounts, financials first, and then bring in the HR. That's not how it rolled out. So HR was implemented first. We then stepped in to do the financial implementation. Where it gets to the point where people were reticent to change, it just is. It's a very large change. You've been on a system for a very long time. You're moving to a new system. You don't get a choice as the individual user of the system or as a leader even of a department, say finance or budgeting. They did not get a choice in that. So there was resistance to the change. And how I worked through that resistance was we built a system of what we would call super users. And we took leads from each of the departments that were affected and impacted. And we brought them into the implementation team specifically. They sat, if you will, at a round table, although it was during COVID. So we did it all virtually during Teams process. And they participated in the setup and the structure. There were certain things that we had to do to make the system work or to provide guardrails, if you will, that we had never had before in a financial system. But they sat in on those decisions and they were able to see the inner workings in the process and how we went about making decisions. They were participants in the decisions. And that change management style of bringing people into the fold and having them participate in the implementation, it went a long way. They had to have a ownership and of the outcome. So when that rolled out, which was successfully done on budget and on time, when it rolled out, they had ownership of each of those individual models. And they became also, the benefit of having them as a super user is they became essentially an owner of that module. People were able to contact them for questions, and they knew it from the day one when we went live.
they were able to take those questions and move with them. Certain ones still had to, kind of percolate up, and you had to come back to the implementation team or go back to the vendor for some significant help if there was some, lurch in somewhere in the a little lurch somewhere in the system. But by and far, they were capable. They understood the process. They knew how the decisions were built in and made, and they were capable of answering questions moving forward.
Jim Barnes, for the record. Ethics are a key factor for leaders in public service. Tell us about a time when your ethics were challenged at work and how you dealt with it. What specifically will you do to ensure high ethical standards in the Public Employees Benefits Program and the protection of the public trust and fiscal stewardship?
That is a key component of any public service position, not just the executive officer. I can tell you that as the CFO for Douglas County School District, at one point, there was a significant discussion by a parental group on the effects of radon in schools. And we had a number of schools at Lake Tahoe that were specifically or integrally impacted by this. And so we chose to do full disclosure, and we took great expense of having all of our schools tested. We brought in outside experts, clear up into, I believe there was a representative from the State of Nevada Health Agency at some point in there as well. I can't remember the gentleman's name off the top of my head, but we did full disclosure, and we did not attempt to bury any conversation, to bury any results. If there were high radon readings, which we did have, we created a protocol, and we had to do remediation. One actually, it was very significant in that we had to perform mitigation efforts. My memory might be a little off, but I want to say it was within 2 to 3 weeks of school starting. And that would have obviously had significant interruption or disruption to not only that school, but obviously all the parents and children. And so the ethics piece of this is the full disclosure. It was, if you asked a question, we were going to answer it. If you did not believe us, we were going to get you the resource and have someone else, take us out of the picture if for some reason you thought that, we weren't providing you with a credible answer. And so I think as whether it's, me as the executive officer or an individual that's working in the PEB office, I think highest of ethics is very much appropriate and required. And the expectation is that's how I would lead. Honesty, integrity are integral to every single public service position. We are paid through taxpayer funded dollars, and we need to be accountable to taxpayers. And specifically when we're talking in this particular program with members' benefits and, retirees' benefits, that's personal. That's very personal. That's not just a widget. It's not just another number. It's personal. And I think that having the first step forward with honesty and integrity is, I'm not going to win everybody over, right? You're going to have disagreements with people. But when you can provide data-driven decisions that reflect why we made a choice, that's something else for me on the ethics, which to me is linked to honest and integrity, is you'll never hear me just say yes. You'll never hear me just say no. You're going to hear me say yes, and here's why. You're going to hear me say no, and this is why. It's accountability and providing full disclosure.
Thank you.
Janelle, for the record. Currently, PEB provides a consumer-driven health plan option and health maintenance organization in Southern Nevada, an exclusive provider organization in Northern Nevada. How would you go about assessing these programs and their effectiveness currently with respect to coverage and fiscal sustainability? And how would you use these findings to improve options for PEB members?
If I recall in my reading, it sounds like these have, low interest or participation. And so if I've read that wrong, I apologize, but I'm going to go off of what I think I've read. So with that, you don't have the current sustainability built within those plans. And so you do need to either look at, what are the drivers of why we're not having plan participation? Is that there is not sufficient explanation. I do know that when you have those types of plans, that people are reticent to join them. I'm very aware of what a PPO does. I'm very aware of what an HMO does, but am I really aware of how that impacts me on high deductible plans? Do I really understand the ins and outs? So could it be a matter of education? My guess is education has probably been offered, and that you just have perhaps a lack of participation. People really are very scared of change, right? If I've always had a PPO plan, I'm scared of stepping over and going to a different type of plan. So what I would do is we'd have to have conversations about what does that look like to provide a sustainable plan? Do you have to change perhaps some of those benefits? Is there a way to bring those folks that are on that plan into the fold of a different plan and then eliminate that plan? That's not something that you do lightly. It's not something you just wave a magic wand and solve a problem. You do have to have consider of information, but I do believe in making data-driven decisions, as well as having conversations and understanding, is it a lack of reticence of people coming and joining that plan? Is it something that you could interest those plan members to go elsewhere into a different plan?
Thank you.
So Laura Rich for the record. Last question, is there anything else you'd like to share with the board about your application and interest in the position? And if you're appointed by the director of the Nevada Health Authority, when would you be available to start?
Okay. Thank you for that. I feel like I've hopefully provided you with sufficient background. I have financial acumen. I have experience with budget forecasting. I have experience with ERP implementation. I have experience with working with teams of people. So I can talk about that experience, but I think what I want to talk about is why this opportunity really intrigues me. I feel that you are clearly in a state of flux and change, that there is an enormous amount of change that is probably already underway and that will be underway over the next several years. And I am not uncomfortable with change. I embrace change. I am a change agent. I do that not lightly. I don't make changes for change's purposes, just to make a change. I think one of the things for me, I believe it was, and I'm going to refer to my notes because I did write this down. There is a person, Rear Admiral Grace Hopper, a U.S. Navy officer. She is attributed with the saying, the most dangerous phrase in the language is we've always done it that way. And I think given that the transformative changes that are already occurring or about to occur, that perhaps PEB and PEB staff can't continue to do it this way. And so for me, I have strengths in the areas of change management and effective communication and collaborative leadership. And I believe those are all things that are needed for this position. And I believe that I could be that candidate for you. And I would welcome the opportunity to join and lead the PEB team. As far as when I would be able to start, I have a bit of a project that I'm underway right now. And so I would like the ability to put a period at the end of the sentence for that. I don't want to leave my current employer hanging. That could take several weeks, but I would think I'd be able to be on board by the end of September if an offer was made.
Thank you. Joy Grimmer for the record, do you have any questions for us?
Well, one of them, you kind of turned it around on me. So, but I would like to still have the opportunity to ask that question, which is, what does success in this role look like to you as the PEB board at 6 months, 12 months?
You want me to take it? Okay. Why am I the only one talking here? A little rich for the record. I think, in my opinion, there's a lot of change happening within PEB and in the new structure of the state with the Nevada Health Authority. So I think short term, probably looking at the, 6 months to next year is working with Stacey Weeks and her team to really identify opportunities to potentially take this program in maybe not in another direction, but improvements, figuring out how we can get to that potentially low-hanging fruit that we haven't really been able to tackle. And then long-term major changes potentially that, maybe taking this program in a different direction, potentially, leveraging, the Medicaid population in a way, or not the Medicaid population, but the as a buyer in the state, as a purchaser of healthcare, and leveraging the volume of people that we have in that population together, how we can, work together with Medicaid to develop strategies that help both the PEP program and Medicaid in terms of, the state in general. And really just identifying, and I think you touched on some of that, that pharmacy is big. Pharmacy is, if you look at the utilization, it's just year over year, it is skyrocketing, and figuring out how we can work together as a state to tackle that, and how we can bring those costs down. So I think really for me, success is partnering with those other pieces of the health authority to figure out where PEB fits in, and to figure out where, what we can do to collaborate and make this program a better program for state employees and retirees.
Thank you. Thank you. Does anyone else have anything they'd like to add? Joy Grimmer for the record. Okay.
Janelle Woodward for the record. This is from a little different angle, but the public employees benefit program. It's about the public employees. It's not all about the dollar. And so I think that when we have a limited budget, this is the money we have to work with, and nothing more. Success to me would be that we're able to, or you're able to come up with ways to give the biggest bang for the buck, I guess, do the best for our employees. State employees typically make less money than even a city or county employee. And of course, our federal counterparts as well. The benefits are a big thing, so you're serving the public, and we may not make much money, but maybe you have good health insurance, or you have, and this is an issue across the board for everybody in every business and across the board, not just state government or local government. But I would love to see that success of doing the best we can with what we're given, and come up with ways to kind of, what can we do differently than what we've done in the past. I've heard that saying that you gave many times. So not what we've always done in the past, but what can we do going forward to come up with some great ideas and look at the opportunities that we have with the change.
Thank you. Any other questions?
I do. One more, which is, what level of collaboration or communication does the board expect from the executive officer throughout the year? You obviously have scheduled board meetings, but could you provide to me some sort of insight? And every board member is going to be different, and I get that. But what would be the expectation of the board as a whole or individually?
So Laura Rich for the record, previous to, I was two executive officers, previously. I think in general, you have to use your own judgment as to when it's appropriate to bring in the board. I know I was the executive officer during COVID, so there were a lot of opportunities to, really, kind of give the board a heads up as to, this is, and things were happening so quickly that we couldn't do it through board meetings. And so I would give updates every once in a while. This is what's happening. This is, what potentially the governor's office is, decisions that are being made that are impacting PEB. We'll have to be talking about this at the next board meeting, et cetera, just so that board members didn't show up or get their board packet a week in advance and be blindsided by it. So I think it's just using best judgment as to when it's appropriate to pull in the board. Obviously the day-to-day details, I don't think it's necessary, and the board members all have, their own jobs and their own roles. And so, it's really using best judgment, I think.
Anyone else have anything they want to add? Okay, thank you.
That's it. Thank you. Appreciate the time.
All right, Madam Chair, do you want to take a break or?
Let's take a short break.
Yeah. I'll get the public slide, the break slide up again one more time. And I'll put you on mute. We're back.
Okay, thank you. Joy Grimmer for the record. We will close out agenda item number 4 and go to agenda item number 5. Discussion and possible action regarding recommendation to the Director of the Nevada Health Authority and the Governor regarding the appointment of the Executive Officer of the Public Employees Benefit Program. This is for possible action. And do we have any discussion from the members?
Okay, I'm gonna start. Jim Wells for the record. Frankly, I am excited that we had 2 candidates who I think either one of them could do the job. I was a little bit nervous when this job posts. You don't always have sometimes even one candidate to come forward and to have 2 of this caliber, I think we're really lucky. And irregardless of where the one that we don't select, I would hope that the state works hard to find a position for the other one in a managerial role, because both of them I think deserve it. And where the state is today, I think that there's more than one opportunity to have for either one of these individuals. I will say that I lean a little bit toward Teresa more because of her 2 things, kind of one, her experience as a participant, 2, her experience with Medicaid and the managed contracts and the health authority in general, kind of going through that legislative session and her experience kind of as the part of the executive team over at the health authority leads me to kind of favor her slightly. But like I said, I've 2 great candidates. Couldn't be more happy.
Thank you. Does anyone else have any discussion?
Laura Rich for the record, I echo Mr. Wells' thoughts. I think they were both really great candidates. One comes with a lot of fiscal experience, and I think that would be great. But at the same time, I do think that Teresa is she's been knee deep in the MCO and healthcare world and understands it on a deeper level, I think. So I think I would tend to kind of think, maybe that she was a slightly better candidate because of that.
Any other discussion from the board?
If I may, Kate Duncan for the record. I would definitely echo those 2 comments. I do know that in the current state, fiscal responsibility is very important, especially with these budgets. I appreciated your comment about doing more with less, I believe it was, right? I think that creativity is going to be very important with whomever steps into this role. I would agree that Ms. Karsten with more healthcare plan experience is very important. I think that world of working through people-driven decisions alongside data-driven decisions, I think she definitely represented that very well. And I would certainly lean towards her as a candidate, as the best candidate.
Thank you. Does anyone else have anything?
Jim Barnes for the record. I'm in agreement. I think they're both excellent candidates, and I would probably lean toward Teresa too, just based on her experience.
Thank you. Is there anything further, or does anyone wish to make a motion?
Yeah, I'll make a motion to recommend Teresa Carthen to the director and the governor for appointment as the executive officer of PEB.
Thank you. Do we have a second?
Janelle Woodward, I'll second that.
Okay. Thank you. Having a motion and a second, is there any further discussion? Okay, seeing none, all those in favor signify by saying aye.
Aye.
All those opposed? Okay, Motion passes. We will close agenda item number 5 and go on to agenda item number 6, consent agenda. Consent items will be considered together and acted on in one motion unless an item is pulled to be considered separately by the board. Are there any items under agenda item 6 that the board would like to pull for further information?
Yes, Jim Barnes, for the record, I'd like to pull 6.2.1.
Are there any other items? Okay. See none. Do we have a motion to approve all items under consent agenda except for 6.2.1?
I'll make the motion, Laura Rich, for the record, to approve all items under the consent agenda discussion item or action item, sorry.
Thank you. Do we have a second?
Jim Barnes, for the record, I'll second that.
Thank you. Is there any further discussion? Okay, seeing none, I'll call for the vote. All those in favor signify by saying aye.
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 All of those opposed? Okay, motion passes. Who do we have here to present on item 6.2.1?
Michelle Whalen, for the record.
Thank you.
Yes, Jim Barnes, for the record, I had a question. I was wondering if you could tell us where PEB is regarding the reserves as of June 30th, 2025.
Michelle Whalen, for the record. As of the reserves, as of June 30, 2025, we are below recommended levels. We are aware of that. That was part of the biennium budget bill to bring in additional premiums and subsidy to bring our reserves back up. The reason we are below is due to the fact that the expenses for medical, dental, and RX claims have been so high that we are currently, what was that amount? $37 million over our budgeted authority for this year. So we have had to do work programs that have reduced the reserves, which was part of the calculations when we were building the budget last fall.
Okay, thank you.
Laura Rich, for the record. I just have an additional question on that. So that's at, we're talking third quarter levels, right? So we're in this is I know the utilization was in the third quarter report. What do you anticipate? What are you forecasting in terms of claims? How much over budget? And then also knowing that that's going to roll into the next budget year and will likely fall onto state employees in the form of rate increases. Is there any plan to mitigate that between now and then? And that may be a Siegel question if they're on.
To answer your first question, that $37 million does include all FY25 expenditures expected through the end of the fiscal year. So I had final numbers by then, so.
Okay, it's not as bad as I thought, okay.
It's not great, but no. And then as for mitigation, yes, that is more of a long-term strategy that does need to be discussed with the new leadership at Nevada Health Authority, with our actuaries, with their actuaries, and with the governor's office.
Oh, yeah, I don't look for it there anymore.
I was waiting for Mr. Wells to ask the
I am
question.
gonna ask a question, though. This is Jim Wells, for the record. What were the actuarially established reserves for the FY25 for the IBNR and catastrophic NHRA? Right now, you're showing them at 33.5, 30.8, and a little over 9. Is that what the actuaries gave you, or is that after you've taken?
No, that is after several work programs. I would need to get those recommended numbers to you. I don't have them right at my fingertips, but I should have them to you before the end of the day.
And was some of that included in the legislatively approved budget to reestablish the reserves?
Yes, sir, it was. Michelle Whalen for the record.
Which is what I thought. Thank you.
All right, thank you. Any further discussion? Okay, seeing none, is there a motion to approve item 6.2.1 Q4 budget report?
Jim Barnes for the record, so moved.
Okay, do we have a second?
Janelle Woodward, I second that.
Okay, seeing no further discussion, I'll call for a vote. All those in favor signify by saying aye.
Aye.
All those opposed? Okay, motion passes. We'll close agenda item number 6 and go to agenda item number 7, Executive Officer Report. Nick Proper, Interim Executive Officer. This is information and discussion.
Nick Proper for the record. I'll be providing a brief update on just 2 transitions that PEB is going through. Today's July 31st, so we're in 31 days of the health authority. So it went into effect on July 1st. And PEB staff has been working very closely with leadership. And there's been some internal changes for PEB, such as moving HR services from DHRM to Nevada Health Authority HR, creating new email domains and new division numbers. Town hall meetings for PEB staff and for all division staff were held late June and early July, with Director Weeks explaining the intent and goals of the program. And last week I attended a 2-day Nevada Health Authority Leadership Summit with actual board members, Ms. Duncan and Ms. Rich. It was actually a great opportunity for everybody to get to know people that I would normally never work with in Medicaid. So I thought it was just a great opportunity to enhance the mission and just see where we're going at. So I want to give a big shout out to Director Weeks and everybody at the Health Authority for a successful rollout of the first 31 days. The second transition that we're working with is with OPM and the Core and VERP system relating to interface files. October 1st is the HRM go live for PEB's payroll concerns. And so currently files have been created, we're in the testing environment and no issues as of yet. So again, this is for October go live and just in the testing phase, but everything's looking good where we're at now. So I'm available for any questions on these topics or next agenda, whatever board prefers.
Thank you for that. Are there any questions or discussion?
I have a question. This is Jim Wells for the record. A couple of people mentioned at the beginning of the meeting, Carson Tahoe. Where are we with Carson Tahoe at this point? I mean, have they pulled out? Are they really telling people that they don't have coverage? Where are we?
Nick Probe for the record, that was news to me. I've talked to other people and I'm in communication with Director Weeks as we speak, and that was news to her. So we are reaching out to Carson Tahoe for verification if they have canceled before the end of the year and if they are telling people that. Because if so, then we're completely blindsided and that was really not acceptable if that is the case. There's meetings in the next few weeks with Nevada Health Authority leadership and Carson Tahoe to work on remediating this issue, but I can't get into any specifics, obviously, but we're definitely in talks. So thank you for asking that.
Thanks.
Hey, any further discussion? Okay. Seeing none, we'll close agenda item number 7 and go to agenda item number 8, discussion and possible action on recommended plan design and master plan document changes for plan year 2026. Leslie Biddleston, Quality Control Officer. Please go
Thank
ahead.
you. Leslie Biddleston, Quality Control Officer. You will hear an update from Brandy a little later in the meeting about the legislative closeout. So this document will address some of those legislative updates. We are not prepared
yet to present everything, so I will be coming at a later meeting with more plan updates. So this today, we'll go over just some of the plan updates. Number one, on page one, this was requested by UMR staff, behavioral interventions. The language that you see crossed out is the old language, and the new language is in red for behavioral interventions. Basically, the old language removed, or the new language removed visit limits and clarified what behavioral interventions are for individuals with obesity and risk factors for cardiovascular disease. So the updated language is in red. That change has already been completed and effective July 1st. So it is in the master plan documents as presented on the website. Number two, going on to page 2, eating disorders. This is a component of the behavioral interventions requested by UMR staff. We wanted to ensure that an eating disorder was included in the mental health disorders that are covered under the plan. So we added just a couple of small words. The words in red are new language. The words in black are existing language. So we just added an eating disorder and licensed dietitian for the medical professional that treats eating disorders. As with the first behavioral interventions, this change has already been completed and in master plan documents. Going down to middle of page 2, the following change will be effective January 1st of 2026. This will be part of the update that you will hear from Brandy in a little while. Genetic counseling. This is from SB 189 passed 2025. Genetic counseling provides guidance and information relating to genetic disorders. It must be provided by a licensed healthcare provider who specializes in that field. So that will be an enhancement that will be effective January 1st, 2026. Moving to the bottom of page 2, this is a mandatory IRS change. This raises the CDHP deductible and, out-of-pocket maximums. That is a typo. We are not changing out-of-pocket maximums. We are only changing deductibles for in-network. And as you can see, it is being raised to $1,700. It's $50 increase for individuals, being raised to $3,400, which is a $100 increase for family members. That change will be effective July 1st of 2026. The HSA, going on to the top of page 3, the HSA contribution limit. This is also a mandatory IRS requirement. It is increasing to $4,400 for an individual, $100 increase, and going up to $8,750 for a family, which is a $200 increase. This change will be effective July 1st, 2026. Moving on to the middle of page 2, we have some enhancements that we are presenting to the board for approval for July 1st, 2026. The first one is speech therapy. Speech therapy, we are removing, so looks like we have a typo. We are raising the age from 19 to 26, and we are including stuttering and stammering in the treatment. We have estimated that the increase to the plan will be no more than $50,000 a year for this change, or enhancement, I should say. Autism spectrum disorder, this next one is as a result of SB 257 from 2025. This revises the definition of autism spectrum disorder in our NRS, and also expands the treatment of autism spectrum disorder. Currently in NRS, these treatments are available up to age 22. There is no change to that. But this red language is new language that will go into the MPDs effective July 1st of 2026. Okay, going on to the next, or did I miss one?
Nick, for the record.
Oh, I missed the wigs.
Yes, thank you,
Excuse me.
Leslie.
I am so sorry. I'm like, I know I missed something. Sheesh. My apologies. Going back to number 2, wigs. Currently, we cover wigs for those who have been diagnosed with cancer and are undergoing chemotherapy. A couple of years back, it was presented to the board that alopecia is something that should be included in wigs. So we did an analysis on how much it would cost the plan to include wigs for those that have been diagnosed with alopecia, and determined that it would be less than $5,000 roughly per year to include alopecia as a diagnosis for wigs. So the new language will read same as above. The red is new language, the black is existing language. So patients undergoing chemotherapy or have been diagnosed with alopecia may be eligible for 1 wig, any type, synthetic or not, per plan year up to $350. That change will be in effect, if approved, July 1st of 2026. Thank you for pointing out my. Okay, going on to page number 4. Behavioral health visits. This is in response to the UMR third quarter audit observation, which you will hear from Joni Amato in just a few minutes. So behavioral therapy, the way that the MPD describes behavioral therapy is by visit currently. And it has been brought to PEB's attention that sometimes a member may have more than 1 therapy session in the same day with the same provider, but different types. For example, a member may have an individual session and then 30 minutes later may have a group session, but it's at the same location on the same day with the same provider. So we wanted to clarify within the MPDs that this is not per day, it is per session and per session type. So if the individual does have or if the member has an individual therapy session on day X, they are required to pay a copay for that. And if they have a group therapy session on that same day, that is also a $30 copay. So this is just a clarification based on the previous, or the UMR third quarter audit, which you will hear about in just a minute. We are not going backwards with this. We are going to make this change effective July 1 of 2026. This is to allow UMR to update their system and all of the edits within their system to ensure that these payments and copays are being collected as intended. Going on to the next one, provider qualification for obesity care management. As you can see, there is some crossed out language and some new language in red. In the past, there were, or currently there is outdated boards and references to certification programs that are no longer appropriate. So we updated the language to allow UMR to bring in providers for this program that may include physicians, nurses, or anybody with a specific type of training. And it's over and above current training, but specializing in obesity management, including diagnosis, treatment, and the management. So it allows UMR to kind of expand their provider pool for this program. And that is all for today's presentation. As I said, I will have more at future board meetings. The recommendation is to approve as presented and allow staff technical adjustments as necessary when plan documents are updated. Thank you.
Okay, thank you. Are there any questions from any of the board members? Okay. Seeing none, is there a motion to approve and allow staff to make additional adjustments?
This is Laura Rich, so moved.
Do we have a second?
Jim Barnes, second.
Thank you. All those in favor signify by saying aye.
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 All opposed? Motion passes. We will move on to agenda item number 9, discussion and acceptance of Claim Technologies Incorporated audit findings for State of Nevada Public Employees Benefits Program plans administered by UMR for the period of October 1, 2024 through December 31st, 2024. Joni Amato, and this is for possible action.
Good morning. For the record, I'm Joni, Joni Amato, AMATO. The scope of the third quarter 2025 UMR audit included all claims processed during the period of January 1, 2025 through March 31, 2025, and it included all medical and dental claims paid during that period. During that period, there was approximately $71.8 million paid, and it included approximately 238,000 claims. The audit included the quarterly performance guarantee validation, 100% electronic screening with 50 targeted samples, a statistically valid stratified random sample of 200 claims. In our auditor's opinion, UMR's performance and overall accuracy maintained its level at 99%. Financial accuracy and claim turnaround time within 14 days and 30 days all decreased just slightly this quarter when compared to the prior quarter results. The performance guarantees for the measures of financial accuracy, overall accuracy, and claim turnaround time within 14 days were all met. The metric for claim turnaround time within 30 days was not met, and a penalty is due for the third quarter in the amount of $13,963.67. CTI also reviewed the quarterly UMR self-reported performance guarantee results for all of the 27 quarterly guarantees, and they found that all of those were met. The random sample audit identified 2 financial errors due to incorrect discount application and 1 claim that was paid in error that was paid outside the timely filing period for the plan. Based on the targeted screening sample, we recommend review of the results to focus on potential recovery and process improvements in the categories identified with errors, for example, duplicate payments, incorrect provider discounts, and some plan exclusions. I'm happy to take any questions you all might have.
Okay, thank you for that. Board, is there any questions? Are there any questions? Okay, seeing none, is there a motion to approve agenda item number 9?
Laura Rich, for the record, I move to approve agenda item number 9.
Okay.
Jim Barnes, for the record, I second that motion.
Any further discussion? Seeing none, all those in favor signify by saying aye.
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 All opposed? Okay, motion passes. We will go on to agenda item number 10, discussion and possible action of pharmacy benefit manager market check. Richard Ward from Siegel.
Hi, good morning. I'm sorry that I'm not able to attend in person. Appreciate the opportunity to participate virtually, and I look forward to joining future meetings in person. Looking at, so this reviews the current contract pricing in the Express Scripts contract, the pricing guarantees with what's available in the market to measure how competitive the pricing is, and then solicit a proposal from Express Scripts to move the PEB contract pricing closer to or equal to what the market has, the best that the market has to offer. Our analysis and the proposal is for plan year 26. But if it's approved soon, if new terms are approved soon by PEB and the board, then Express Scripts will be able to apply this improved pricing retro back to July 21. I mean, normally we're having this discussion in March at the March board meeting or at the May board meeting, but right now in the industry, the emergence of biosimilars is changing the rebate landscape and really complicating things. So there are a number of drugs like Humira that are widely used or have been widely used that are heavily rebatable that now have or will soon have biosimilar alternatives which are not generally rebatable. So the average rebate per script is changing within the industry, and accommodating that within a competitive contract structure with appropriate pricing guarantees is more complicated now than it has been in prior years. So this process took longer this year than it has in prior years, and we appreciate the collaboration with Express Scripts on this year's review. So market check is, as I said, we compare the current pricing with what the market has to offer, and how we determine what the market has to offer is that we select other peer entities which are comparable by demographics, geography, the program composition, and benefit levels. And in this peer group, it's mostly other Western states and includes contracts that are with a range of PBMs. So we're really getting a good variety of peer experiences in the industry. We take a focus on net costs, and I'm going to direct us to page 244 of the packet, which is page 2 of our report, where we summarize the net drug spend, net of discounts, and then admin fees and consider rebates to get to the total net cost. And that's really what our focus is, because it would be okay to have less aggressive discounts or less favorable discounts in exchange for better rebate terms, or vice versa. So we're taking a total net cost here. And while rebates are a significant component of the value of the net pricing guarantees, we're not chasing rebates for the sake of maximizing rebates. And that's notable here because in the top line of this table, the current contract terms are already more favorable from a claims discount perspective than the benchmark average, 128 million versus 134 million. So the current pricing guarantees for discounts are already more competitive or more aggressive than the market, than we generally see in the market. And then skipping down 3 rows to rebates at just below 43 million in that first column compared to almost 51 million in rebates. That's where the current contract is less competitive. And so we solicited a proposal, PEB solicited a proposal from ESI to improve contract pricing terms. And as a result, we have an improved schedule of pricing guarantees for both discounts and for rebates that moves about halfway between the difference that we see between the benchmark average and the current contract terms. So just looking at the bottom row here, or the bottom rows, the current pricing is about 4.7% below a competitive benchmark, or about 3.1 million. And the proposal from Express Scripts is about a 2.4% improvement, or about a $1.5 million improvement. And in our opinion, this is a good, fair offer given the changes in the market and the timing. And it is our professional recommendation to accept this proposal. I'll pause there to see if there are any questions or discussion.
Are there any questions from the board members? Okay, seeing none, does anyone wish to make a motion, or do you wish to table this to the next meeting?
This is Laura Rich. I think that we should make a motion, or I want to make a motion to approve the new favorable contract pricing as suggested by Siegel.
Okay, thank you. Do we have a second?
Jim Barnes, I second that.
Okay, any further discussion?
Yes. This is Jim Wells. Richard, I think you said something about if we approve this timely, it would be retroactive. And I thought you said to July of 2021, but is that what you said? Is that what you meant?
I apologize if I misspoke. What I meant to say, and what I should have said if I didn't say it, is July 1st, 2025. So it'll be for the full 12-month period of plan year 26.
Okay.
Sorry
That makes more sense. And it still looks to me as if we are on that table on the second page, the market, we're still above what our peers are paying in our region.
That is correct. And the peer average, but there is a range of terms associated with that average. And so while we're not showing a range here, the total value of the current contract terms is fairly close to the range of net value that we see in the benchmark group. And it can be challenging to negotiate a renewal when there's not when it's not an open bid that you would an open bid process that you would have with an RFP. So it's not as competitive an environment, I guess.
And so looking at the table on page 3, you kind of give that range. So I'm taking it, that's kind of where that range came from, that's getting your average in the table on page 2.
Correct. And that's looking at it on a line item basis. So some of the peers for one line item, a given peer for a given line item might be at the low end, but they may be at the high end for another line item. And then we take the total value for that particular peer.
It's all about moving numbers. I will tell you, my only concern with this, if you look at the table on page 3, is the reduction in the discounts for brands where all the expenses are. Generic do go up, but not nearly as fast. We're getting some better discounts on the generic stuff, but I have a little bit of concern about the reduction in the brand discounts. That's just my personal opinion.
Thank you for that. Okay, any further discussion? Okay, we'll take a vote. All those in favor signify by saying aye.
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 Aye. All those opposed? Okay. Motion carries.
No, I'm fine.
Okay. Okay, we'll close this item and move on to agenda item number 11, presentation and possible action on the status and approval of new PEB contracts, contract amendments, and solicitation. Michelle Whalen.
For the record. Section 1 lists the current contracts as of today, which includes the newly executed contracts for Extend Health, Willis Towers Watson, and also Health Plan of Nevada. No action is necessary. No new contracts to discuss at this time. Contract amendments, as discussed, Express Scripts, we would like to move forward with the amendment to include the Plan Year 26 market check letter, incorporate updated pricing for the Hinge Health program, and also add additional authority for Plan Year 26 as the increased costs, we're running out of authority in the contract. We'd also like to extend Diversified Dental, our dental network, for 1 year to give us time to work through some of our other RFPs and other contract negotiation items. And then we need to revise the Eide Bailey, the state outside auditors contract, as the state financial audit is so far behind. They are just now gearing up the SFY 24 audit. So the funds that were approved for plan year or fiscal year 25 need to be moved forward to 26 to expend for the state fiscal year 24 audit. Staff recommends approval of these contract amendments as stated above. Current status of the solicitations would be eligibility enrollment has been awarded to the winning vendor. Negotiations are ongoing. We are working with leadership at Nevada Health Authority to move forward with that. And the rest of the RFPs are currently pending based on the need to get guidance from our new leadership. Any questions?
Keiko Duncan for the record, and excuse me, as a new board member, maybe I missed some conversations, but why is the fiscal year 24 audit delayed?
You would need to speak to the controller's office and Eide Bailey about that.
Okay.
So this is Jim Wells for the record. The controller's office has been behind for, I think this is the third consecutive year, and they continue to fall further and further behind in the schedule for doing the state's master audit. And so because the state's master audit's not been done, there's no reason to pull in the individual audits from the individual departments.
Makes sense.
They keep telling me that they told me before I left that the intent was to be back on a normal cycle, not this fiscal year, but next.
Happy.
Thank you, Mr. Wells.
Yes, thank you. Okay, any further discussion? Do we need to take a motion to,
Well, there was one recommendation, so yes.
all right, do we have a motion to approve this item?
This is Jim Wells. I'll make a motion to approve the contract amendments that were outlined in agenda item number 11.
Okay, do we have a second?
Jim Barnes, I second the motion.
Thank you. Is there any further discussion? No. Okay, seeing none, all those in favor signify by saying aye.
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 All those opposed? Okay, motion passes. We will close agenda item number 11 and go on to agenda item number 12. And I have been asked to turn this over to the Deputy Attorney General at this time.
Madam Chair, it is my understanding that this agenda item is noticed for an election to the chair position of this board. Is that correct, Madam Chair?
That is correct.
Perfect. So pursuant to the Robert's Rules of Order and relevant NACs, the procedure is to identify a presiding officer, which can be you or your designee, and then open the floor for nominations for the position. Just to highlight, only the voting members can vote on it. That would be all board members for PEB. After the nomination process, Madam Chair, the chair for this election process would close the nominations. Depending upon the number of nominations, it would either be an uncontested or contested election. If it is an uncontested election, well, Madam Chair, the chair of the election process can proceed to taking a vote or the election. If it is a contested one, the procedure involves allowing all nominees to make their case or make a statement to the board prior to proceeding to the vote. And the nomination does not have to be seconded, just to highlight. And at the end of the voting process, Madam Chair, the chair of the election will get to declare the winner or the elected, who would then become the chair moving forward for this vote.
Okay, thank you.
Thank you.
I will act as the chair for the election. I would like to make a motion to elect Jim Wells as the Public Employees Benefit Program Chair. Are there any other?
I'd like to make a motion for Joy Grimmer.
That's two motions.
I'm sorry.
Madam Chair,
I'm
this
sorry,
is
whoever
Radhika.
made that motion, I don't know who was talking.
Madam Chair?
No, Woodward.
Thank you.
Nominate, I'd like to nominate you, not make a motion.
Any other nominations?
Can we discuss?
Yeah. Okay, board members, we can discuss. Please let us know if we cannot discuss an item.
Madam Chair, if I may interrupt here, this is Radhika Kanal for the record.
Thank you.
So we have two nominations, as I see. So the next step would be to allow them to make their case, each of them to make their case. Would you like to close the nomination process first? First is, would you like to close the nomination process? And after that, I'll give them an opportunity to make their case, Your Honor, Madam Chair.
Do we want to close the nomination process? Is there a motion to close the nomination process?
I'll move to close the nomination process. Laura Rich.
Okay. Do we have a second?
Wayne Harper for the record, I second.
Thank you. Okay. All of those in favor of closing the nominations, signify by saying aye.
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 All those opposed? Okay, motion carries. Okay, Joy Grimmer for the record, I will go first. I would like to say thank you for my nomination, but respectfully decline and put my vote in favor of Mr. Wells.
I was gonna do the same thing.
Oh.
No, I appreciate the nomination from the chair, and I would be willing to accept it if that's the will of the committee member, the board members.
Okay, thank you. Do we have a motion to approve Mr. Wells as the board chair for PEB?
I'll make the motion to approve Jim Wells as the PEB board chair. Okay. Laura Rich.
Do I have a second?
Keiko Duncan, seconded.
Okay. Any further discussion? Okay, seeing none, all those in favor signify by saying aye.
Aye.
Aye. All those opposed? Okay, motion passes. We will close agenda item number 12 and move on to agenda item number 13, public comment. Public comment will be taken during this agenda item. Comments are limited to 3 minutes. Do we have anyone for public comment here in Carson City? Okay, seeing none, do we have anyone online?
We have two in the lobby right now,
Okay.
Madam Chair. I'll get the slides right now.
Thank you.
Joining the Zoom meeting as an attendee is for making public comment only. If you do not wish to make a public comment, please leave the Zoom meeting now so you're not accidentally called upon. Please feel free to watch it via the YouTube live stream on the YouTube channel. The link for the live stream is located on the agenda. For those who have joined for public comment, your name and the last four digits of your phone number will be announced and you'll be advised you've been unmuted. Please slowly state and spell your name for the record if you wish to make comment. Caller with the last four digits 4108. Please press *6 to unmute. And please slowly state and spell your name if you wish to make public comment.
And I'm sorry, who is this speaking?
This is PEP staff. Sorry, I'm just I'm running the show. Try one more time. Last caller with the last four digits 4108. Please press *6 to unmute if you wish to make public comment. I'm sure that is all we have for public comment.
Okay. Seeing no further public comment, Joy Grimmer for the record. I will close public comment and we will adjourn. Thank you for everyone's time today.